Welcome back. I'm Dr. Drew Ramsey. What a great question. How do we know if we're depressed? I wanted to talk about this as a psychiatrist and someone who's been treating depression for over 20 years. It is very likely you could have depression. It's one of the most common and most disabling medical conditions in the world. It's the top cause of disability. And there are a lot of different factors that play into depression. It's one of the reasons this question sometimes is really hard to figure out. In psychiatry, we use what's called a biopsychosocial model. And that means we're looking at these three buckets. We're looking at biology, understanding how that affects your mood. We're looking at your personal psychology. And then we're looking at the social factors, things like oppression, trauma, things that could influence and lead to a depression. So first, let's talk about some of the symptoms, and then I'll talk about some of the real key points that help me diagnose depression and help individuals, I think, really know whether it's time to take a step in terms of getting some treatment. So the symptoms, there are two really that you have to have a depressive disorder. The first is a low mood. And it's easy to say, what does that actually mean? It means that we feel down, you wake up, you're just not looking forward to the day. There's a lot of pessimism, not a lot of hopefulness. Your mood is just lower. You're not excited about things. The second symptom that has to be there is anhedonia. It's a big word that just means a loss of pleasure. You're not enjoying things as much as you used to. Just think about one of your favorite activities, and if you do that and it doesn't really spark any joy in you, it's a signal that you have some anhedonia. I often see that people experience this first in their relationships. They just aren't really enjoying them as more. Obviously, a lot of reasons that can go into that, but sometimes it's depression. Let's talk about some of the other symptoms that sometimes surprise people. Depression has a lot of biological symptoms. So there's often a disturbance in sleep. This is one of the most common symptoms. People either have problems falling asleep and staying asleep, or they're sleepy and kind of down and having a hard time focusing and staying awake at all times or most of the time. Another symptom is a change in appetite. People can both have an increase in appetite or a decrease in appetite. And with that comes some weight gain or weight loss. Carbohydrate craving is often very common in depression. There's also a common symptom of increased tearfulness, of just sad things kind of making you cry, maybe sometimes suddenly. So if you're having some of these symptoms, it's possible that you have depression. I want to mention one that's quite serious and concerning, which are suicidal thoughts. These are pretty common in depression. You don't have to be making a plan or really actively thinking about suicide to have suicidal thoughts. These sometimes I hear a lot from patients are just thoughts of not really wanting to be here anymore, not wanting to be around, or feeling like a burden on people. If you're having any of those thoughts, or if you're actively planning any act or having thoughts about taking your life, this is for sure an indicator to get help right away. So those are some of the symptoms of depression. Where does depression come from? It comes from, as I said, a lot of different places. It can be due to medical conditions. A lot of times, low mood and depression can occur after pregnancy. Grief and trauma highly correlated with depression, as is substance use. So if any of those kind of categories apply to you and you're having a lot of those symptoms, how do you know if you're depressed? Well, the way that we really like to think about this in clinical practice is around your functioning. And I say this with a little caveat, just I've treated a lot of people with severe depression who are functioning really well. They're going through the motions, they're finishing their work, they're engaged in their relationships, but on the inside, they're really struggling and have depression. But one of the ways certainly we do know for most people is functioning goes down. You're just not able to be your best self. You're not able to get work done or to be as creative in your interpersonal relationships. You're not as present. You're not as generative or engaged. You'll find yourself often with depression more isolated. So if you're seeing your functioning, and in my practice, we think about this in terms of work and love. It kind of goes all the way back to Freud. Freud said psychoanalysis was a treatment that cures problems of work and love. And today in the DSM-5, which is our diagnostic Bible in psychiatry, all of the diagnoses kind of end with this idea that these symptoms are severe and they cause a problem with your functioning. So if you're having any of the symptoms that I've mentioned, the diagnostic criteria says for 2 weeks, but even if you've been having them for a short amount of time or if you've been having them for months. I hope this video helps you think about maybe you do have a depression diagnosis. In some videos later, I'm going to talk about what are some of the treatments and what are some of the causes of depression. But I wanted to make this video just to go over the symptoms and have you hear a little of my perspective as a psychiatrist. I find so many people have some of these symptoms, have a bit of depression, and they don't ever seek treatment. And treatment can be with a professional like me or my team. It can also be by engaging in activities in your life, in your community that just help perk up your mood and help you feel better. Depression has a lot of causes. It also has a lot of treatments. And I hope you hear this as encouragement to take a step in taking care of whatever symptoms you're struggling with. I hope this video is helpful. Please subscribe to our channel so you don't miss any of the upcoming videos. And check out our Friday Feels newsletter on our website. We try and send out some helpful tips, some good science, and a tasty brain healthy recipe every week. I'm Dr. Drew Ramsey. I look forward to seeing you in the next video.